I completed Clark College with my undergraduate in biology, and then I went on immediately from there into the physician assistant program at the University of Wisconsin-La Crosse. He followed me and moved to Mauston, Wisconsin, started his practice, or career, I should say, not his practice, but his career, until I finished PA school, and then we moved down here.
Yeah, I mean, being a PA is so in demand, and if anything, so many more of us are just, that's who we see directly and not the doctors. I mean, that's a pretty critical role and very, there's a lot riding on what you do every day.
Yeah, I've been doing it for over 20 years now, and I hear it from a lot of patients most every day, how grateful they are, for them to be able to see me for my continued, I've been at my current practice for probably 11, 12 years now. And so it's just that consistency that they get to see the same face over and over again, with all the turnover that there is these days. Patients are very grateful for someone being steadfast and loyal.
And I would especially imagine in internal medicine where, that's just a hard, I'll just say it. My husband and I have dealt with like 3 or 4 new doctors within the last 2 or so years.
Yeah.
So when you mention turnover, especially in that area of the health, I could be wrong. I mean, tell me if I'm wrong, but I would think that's really critical in the line that you're in medicine.
Absolutely. Yeah. And I think it's one of those things, my passion for patient care is that I love to get to know people. And that's something that is actually proven statistically month to month on a patient, satisfaction score. And 1 month last year, my manager at the time said, "Can you do a video or a talk for our office about how you consistently get this impeccable patient satisfaction score?" And I said, "Well, I don't think I need to do a video or anything like that." I said, "It's pretty simple. You just talk to the patient and genuinely express interest in their lives." And I think that means a lot to them, because I feel like the social, aspect of someone's life actually does really impact their overall health. And so I think there's a lot of questions there that are important in how you're treating that patient.
Well, I think it's interesting you say that, because I do think in this day and age, we've lost, or maybe we never had, that art of real deep communication, getting beyond a first few questions. And whether sounds like you're a physician's assistant, what I do as a wealth manager versus, CPAs versus, of course, it's all people I know, but anybody in business, relationships are so important. And I probably wouldn't think of it as you had just explained inside of medicine. But so you kind of shrugged it off, but how do you do it? Like you talked about, how are you different?
Yeah.
Like if I were to come in and talk to you, what would be so different?
I think the one different thing is going to be, I'm going to ask you, what do you do for a living? Are you married? Do you have children? And from there, it just kind of opens up who you are. And I feel like it's storytelling, exactly like what you're doing on this podcast. You start to gain more and more information from that person, and it just builds a picture. And you actually learn a lot in terms of, okay, if we're treating anything, that's going to make a decision or an impact on how I'm going to treat you. So.
Right. Not just the symptom or whatever they're presenting to you at the time.
Yeah.
What I'm sure lots of people will be listening and saying, "Oh, fascinating." into everything else beyond just the moment in hand. But I'm sure that's difficult in the, high, fast-paced world that you're in. Yeah. And that is probably, see patient. But if there were just a few more minutes to take, you could keep them healthier longer.
Yeah. And I think we are getting to this point in medicine, which is actually sad, where patients are numbers. Not something I'm very excited about. It actually gets me very frustrated when we have our monthly meetings talking about numbers and things like that. At the end of the day, when they say, "Hey, Johanna, you're not earning your bonus this year because you didn't hit X RVU numbers," I don't actually care if I do or don't. It's not going to change how I practice medicine. A patient is not a number to me. That's it.
Yeah, I mean, it reminds me of a year or two ago, we were going to see one of my doctors, and they had asked me a question. I was like, well, sure, I guess we could talk about that. I mean, I'd be interested in learning more. And then you get the bill from the hospital however many months later, and it's like, it was just a regular well visit, and there's a charge on there. And I eventually, after call after call after call, find out it's because I asked a question. And I thought, well, I didn't even really ask that question. So
Yeah.
from your standpoint, I mean, something we find in some of these podcasts is people talk about how do you advocate for yourself, especially in medicine. What advice would you have for people who are going to see their physician's assistant, their doctors? What are some things that they could do to have a better experience or make sure they get across the vital information for you to do your job within a number system?
Yeah. No, and I actually hear this a lot, even from patients, or they'll tell me experiences they've had in a hospital, for instance, or at an urgent care. And a lot of people do not know how to advocate for themselves, and they will just do whatever they were told that they should do versus knowing if that was actually the right path or course of action. So I'm pretty frank and honest with them and tell them, if this has happened to you or if this is your experience, you really need to either call and report this, because there's some serious consequences that can happen.
Right.
But the minor things in terms of how they could better advocate for themselves, I think people just need to just do their own research at this point. I know people say don't Google and all those things. I'm not telling people to go Google, but it's also, do you want to go in and just be handed a prescription and be told, take this, and really not know why or what it's for? That's something that actually scares me. So